the feedback that I've gotten was that it was really helpful for them, and that they couldn't describe what it was that was so helpful, but it made them feel better, and they even couldn't find the words to say how the sessions work or what we do, but there was something about it that was so beneficial.
Every year, around 1 in 4 UK individuals will be diagnosed with some form of mental illness. Whether that be anxiety or depression or something more serious such as schizophrenia, many people are suffering. Although this statistic is a large number of people, many are also living their lives with mental health issues and go many years not receiving treatment or being diagnosed due to the fear of the stigma that is attached to mental illness. Although more is being done to help those affected by this stigma, it is nonetheless still apparent in society today. The treatment offered to patients includes both medicinal treatments and alternative recovery therapies, such as drama therapy and other talking therapies. Doctors, psychiatrists and drama therapists all have varied views about the treatment that should be used to treat patients, with the decision largely based upon the individual's situation and symptoms.
So I'm Charla Givans, and I'm a drama therapist, and I also have done a PhD in drama therapy, looking at childhood depression and how we evaluate drama therapy.
I am Dr. Susan Smith, and I am an integrative psychotherapist and a medical doctor. I specialise in things such as CBT and psychodynamic therapy regarding different issues such as eating disorders, bereavement issues and personality disorders.
Yes, or I guess I wouldn't be doing this work, but I think that drama also, that it's drama therapy is very important, but the roots of it are in the dramatic art form, and the idea that the dramatic art form in and of itself as a container is in a sense therapeutic and healing, I think helps to make the therapy effective. So we have the container of the art form that furthers the effectiveness, and then we have everything else about any type of therapy that people would have would be the rapport, the boundaries, the professional safety. All of those things are encompassed in that. But I guess there's also the effectiveness of the drama and what we're using in the sessions that maybe might have a different quality to only talking therapies or just talking.
I think that for some people drama therapy and other alternative recovery therapies are more effective than medication because they get to the root of the problem that the patient is suffering from and prevent the recurrence of the issue. Although everything affects everybody differently, and some people tend to benefit more from the medicinal treatments. The only problem that these can sometimes provide is that they simply mask the problems felt by the individual rather than addressing them directly and Sometimes, in my opinion, the impact of a talking therapy is definitely more encouraging of a recovery, as well as reducing the length of time a patient will need to recover.
I think one of the main things that does happen kind of pretty consistently is that because people are finding different ways to express themselves, and maybe there's a freedom in that, the confidence increases. So they might have, more confidence, and when there's more confidence, maybe there's a greater ability to then face any difficulties. So I think that does help kind of consistently. But also I think as a practitioner, for me, one of the things is that we're really able as drama therapists to get to the core of maybe a problem for people without needing to talk about it.
Would, yes, because as a doctor and a psychotherapist, you quite often come into contact with people who suffer with quite serious bouts of depression and other issues, and without the medication provided, many of them wouldn't be able to function to a high enough standard to recover. Most people require a combination of the two, the medical and alternative recovery therapies, in order to fully tackle the effects of depression or other illnesses they're struggling with. The fact is that antidepressants only reduce the symptoms of depression and help a person to carry out the small daily tasks and function to a general standard, rather than actively aid a full recovery. A full recovery often requires some form of talking treatment for most people, like a drama therapy or counselling, for example, to get to the root of the problem and allow the emotions that they're feeling to be released in a one-on-one talking environment.
For some, especially for depression, maybe drug treatments can be very beneficial. I think there's also been a lot of, especially young people, in adolescents who say that the drugs make them feel worse, and maybe make them feel more suicidal, and I think there's a period of time where the drug treatment needs to be the right amount, the right, all of that needs adjusting, and in that there might be a lot of difficulty and uncomfortable sensations and side effects and all of that.
Although within my profession I do prescribe medication to those who need it, I believe that the best results come from the use of the holistic approach. So, holistic is definitely my preferred treatment, with medicinal treatments being used as a last resort if the patient feels that nothing else that we are using is working with them.
I think that, without sounding biased, I honestly do think that it can work well in conjunction, it can work well on its own. I think that there's such flexibility and there's such a need for the way that we as drama therapists work, that kind of any area that can expand how and where we work would be great.
Despite medicinal treatments being successful in the short term, they have many downsides such as masking effects and side effects. Many people take antidepressants as a quick fix. However, they don't get to the root cause of the emotional side of the illness, and therefore many people need treatment later in life. On the other hand, drama therapy is a more definitive way of helping someone through a mental illness. Although drama therapy is slightly about exploring other characters, it's mostly about exploring yourself and your feelings and being able to express them in a safe environment that other people may not have. However conclusive this may seem, each individual reacts differently to treatment styles, and therefore some may not even require any medical treatment at all. Despite being a successful and positive way of encouraging recovery, drama therapy is rarely offered as an option to patients by doctors. But I believe that this would be the first step in beginning to tackle the stigma surrounding mental illness.
I think that sufferers need to be given more information on what services are available to them so that everyone has an equal opportunity to access treatments. And because alternative recovery therapies aren't often provided on the NHS, those who it may actually benefit aren't able to afford them or simply aren't aware that they exist in the first place. So there's definitely a need for more advertising of these.
We as drama therapists do a lot to kind of, help people understand, but it would be nice if maybe, within the medical model, and you're talking about GPs and different people who could kind of support it. Yes, that would be great. I'm not sure if they're ready to, but it would be great, yeah.
Yeah, I agree.